I'm a nurse educator since I'm in academia, but I'm not a clinical nurse right now. And my role in the hospital is really more around patient support and education. But I think any oncology nurse that is practicing right now knows that the demands on the nursing field has just been outrageous. And I use that word purposefully over the past several years. And the rates of nursing burnout, workforce shortages have impacted every sector of nursing, especially oncology nursing. And that the only way that we have to increase the number of oncology nurses or any other type of nursing is to make sure that we have enough people to clinically and academically instruct the next generation. So, for nurses that are interested in adding that educational component, of course, there are opportunities in a clinical setting to be clinical preceptors or to mentor advanced practice providers like nurse practitioners who are looking to learn from clinicians' expertise. There are also ways to get involved again in more the academic side and to think about becoming either an adjunct, part-time, or full-time faculty member at a school of nursing so that you can have a more formal role in nursing education, which is really the bottleneck right now for why there is a shortage of nurses across the United States. It's just that we do not have enough clinical faculty members to teach the number of students who want to become nurses. One of the ways that I think most nurses are comfortable with is to work up a clinical ladder, usually involves mentoring nurses that are coming in after you. And so being a preceptor to other clinical nurses and teaching them the ropes of your unit and making sure they're meeting their milestones about the specific unit specific trainings they need and hospital specific metrics is key. And I think if someone has a passion for that or really gets joy out of working with more junior nurses, then thinking about moving from, I don't just want to be a preceptor, but maybe I also want to be working more officially at a school of nursing as a preceptor or a clinical faculty member. And really, since there's such a need for these types of nurses, I think there's all different types of arrangements, again, from saying, I want to do this full time and work at a school of nursing where I'm working with undergraduate or graduate students in teaching them clinical skills and even academic, more lecture-based discussions, or working at a more reduced capacity where you can maintain your clinical practice and still have a role in formally teaching clinicians and students. So whether you want to, again, I think a lot of nurses are reluctant to leave the bedside, and you don't have to fully leave the bedside to become an educator, but to get an adjunct or a part-time role in teaching clinical nursing is something that most schools of nursing are clamoring for. So there's probably ample opportunities. While most of the work that I do is research, since I teach at the University of Pittsburgh, one of the most fun things is to have undergraduate nursing students and graduate nursing students, and to be able to teach them what I'm passionate about. So I teach an undergraduate course in health disparities, I teach a graduate course in health policy, and really get to translate what I do from a research side and teaching the next generation of nurses. But I think more than the topics, it's just being involved and interested in making sure that incoming nurses understand the role of a nurse professionally. And I think that's something that most clinical nurses recognize as a need, and to be a part of that and to learn from them and get to experience the joy of discovering nurses is just an extremely rewarding experience. So of all the things that I do during a day, my time, especially with my undergraduate nursing students, provides a lot of motivation and inspiration. And I think that if anyone feels that same way, then pursuing those interests in becoming a nurse educator could be a really great way to make sure that your interests continue and that we, can alleviate sort of the stress on current nursing and the shortages and burnout associated with oncology nursing right now. Over the past couple of years, there have been so many stories in the news about the need for more nurse educators, and we've known this for a long time. So I would just say to try to pursue different options. And there are, full-on 4-year degree, Bachelor of Nursing Science degrees. There are associate degrees. In Western Pennsylvania, where I am, there are hospital-based programs to educate nurses. So hopefully around where people are, that there are places where you could become involved in a formal or even more informal way, and that, the profession really is in need of it. So those people that feel inspired and get something out of that teaching and mentoring, we really need you. So to continue and to feed that interest and pursue different options would benefit all of us, including our patients.